All right, welcome back. It's time for Health Watch. We're here with Dr. Syed Hussain from Trinity Health of New England. We're just a week away. It's a week from tomorrow. We've got Thanksgiving. That's kicking off the busy holiday season. We're going to be gathering with a lot more people than maybe we normally do and seeing people that we don't normally see. So what do we need to know? What do we need to keep in mind to keep our families safe?
Sure. Morning, and thank you for having me. So folks need to keep in mind that we're not living in 2019, but they don't need to act like it's 2020. It's some middle ground that we need to take. And what I would suggest the best way to go about these holiday gatherings, which will take place, is tailor those gatherings around the highest risk individual in your family or the gathering. So what do I mean by that? So anybody who's above the age of 65, underlying medical problems, immunocompromised, on immunosuppressive medications, active cancer therapy, those people are highest risk for developing severe COVID-19 complications, illness. So what are some precautions that folks need to take if you do have such people in your gathering? Then you need to make sure that you're up to date with vaccinations. So that includes the bivalent booster. I'm a little concerned with the uptake around the country. It's been pretty low. 10% of eligible Americans have so far rolled up their sleeves. So more work needs to be done there. And then also get tested. It's not a bad idea to get a rapid test 2 hours before the gathering to ensure that everybody is safe and everyone is negative. So those are some common sense precautions that we can take to ensure safe gatherings.
Would you say if someone's traveling from far away, if they were on a couple planes, would you suggest masks or just sort of play it by?
Absolutely. Okay. Masking is definitely recommended. It's going to be crowded. This is a very busy travel time. So wearing a mask, I wear a mask in crowded indoor situations. It's not a bad idea.
All right, good to keep in mind. All right, another thing that a lot of people are talking about, a lot of people are concerned about is RSV, specifically with infants. It is just such a scary situation when children were discovering that your child, your baby, you cannot breathe. Right?
Absolutely. So folks need to keep in mind that it's not only children, but also adults. We're seeing a higher number of cases. And so regardless of the age, the symptoms can resemble the common cold. So as soon as symptoms develop, then it's always good to get tested. Although there's no treatment or vaccine currently available for RSV, it's important to get tested. Why? Because you want to be sure you're not missing out on flu or COVID-19, because there are antivirals to shorten the duration of illness for COVID-19 and flu that individuals can take. Now, if a person is diagnosed with RSV and they develop shortness of breath or wheezing, those are some red flags where you really need to arc up concerns to your doctor or go to the nearest emergency room to see if you qualify for oxygen and other therapy.
Now you're saying there is no treatment or vaccine, so what are people supposed to do when they go home and they find out they do in fact have RSV? Yeah,
it's what we call supportive management. So rest up, drink plenty of fluids, get a telehealth visit with your doctor to see if there's any other medication, fever-reducing medication.
Is a humidifier in this type of situation something that's helpful or not so much?
Sure, it can be, depending on where you live and how your conditions are. If you have any underlying medical problems, etc., that may preempt you from, getting an inhaler or something like that, then yes.
And what's the recovery time?
So usually if there's a cough that develops, it can take several weeks, but a couple weeks is usually what we see.
Okay. All right. Dr. Hussain, thanks so much.
Thank you.
As always, great to have you on the show. We are so grateful to have you here.
Thanks much.